Lush foliage, comfortable places to sit and socialize, natural ventilation. It's what you might expect at a holiday resort. But this is the Khoo Teck Puat Hospital in Yishun in northern Singapore. Opened in 2010, the public hospital has earned accolades for its green design and energy efficiency, built to offer a new level of healthcare for the 21st century. Liak Teng Lit, the CEO of Alexandra Health System, which manages KTPH, says the hospital was destined to be innovative and different from the outset.
When the former minister gave us the assignment, he said, build the hospital with the patient right in the center. It is for them, not for the staff. Many hospitals are actually designed for the staff, for the convenience of the staff, not for the patient.
Liak says one of the key directives to the building architect was to make this a place where the patient will never get lost. Clear signs and minimal travel distances are key.
When they step in, 10 meters they get emergency department, 20 meters they get to a clinic, and the furthest point is 100 meters you get into the ward, lift lobby. So this is the kind of thing we spec.
It's also spec'd for speed. Liak says they've set a target of getting 70% of the patients at the clinic and emergency department registered, examined, treated, and released in 1 hour. As with any building in Singapore, the architect had to take the tropical climate into consideration. At KTPH, not every interior space is air-conditioned, rooms in the subsidized ward, for example. But that doesn't mean they're hot and stuffy.
The buildings are designed for ventilation so that there's always a crossflow of air. We use very old-fashioned jalousie windows so that there's a crossflow of air through the non-air-conditioned block.
The innovations extend beyond the physical plant to the care and treatment of patients. Liak says some of their best ideas came from industries outside of healthcare. They studied the cruise ship industry to come up with ways to prevent patients from falling. And one idea borrowed directly from Toyota is the Andon board. The carmaker pioneered the use of the lighted board to identify production problems. KTPH adapted it to track patient flow to make sure there are no service bottlenecks. Situated in a mature housing estate, KTPH tries to be a good neighbor, with a strong emphasis on nature and community.
We actually hid the aircon underneath the garden, although you can still see the air vent coming out of the whole thing. So instead of eyesore, it's actually a pleasant view for people. And we also designed the hospital to become a community garden and a park for the neighbors living around us. So every day you actually see our neighbor coming in here to study, they bring their children here to look at fish and all this thing. Right?
Now that the hospital has been up and running for a couple of years, Liak says there are a few things they could have done better, like build more overhangs to keep heavy tropical rain out, but overall says they got it about 80% right. We asked him in an interview what's his favorite part.
The next hospital we're building.
That would be the new community hospital under construction next to KTPH that will serve those needing long-term or nursing home care, what he calls slow medicine. Despite all the attractive features incorporated into KTPH and the new facility, ultimately Liak says the hospital is not the most important part of healthcare. In his words, it's no more than 10% of the equation.
At the end, health is actually not what a hospital does. By the time a person arrives at the hospital, it's too late. Right? And at best we can do is to patch them up, keep them alive. Health is really what a person does himself or herself. From the moment you wake up in the morning and what you do, what you eat, and going to bed, health is actually about individual, and it's very hard for individuals to do what is right for themselves.
KTPH has that covered too. Liak says they're rather ruthless in getting the staff to exercise and eat well, creating a healthy culture befitting a modern healthcare facility. For NUS Business School, I'm Katie Sargent.